Hi, this is Professor Tiffany Martin with Medical Microbiology, and we are working our way through Chapter 1. We just finished Jenner, and now we're going to talk about three people who had a lot of influence in our creation of our modern day aseptic techniques that we use to prevent infection. Aseptic techniques is when you create an environment or undergo a procedure that is free from contamination. We are reducing or eliminating the microorganisms in the environment. Now that we know microorganisms can cause disease, aseptic techniques utilizes techniques that allow you to reduce the number of microorganisms in the environment. So first up, we are going to talk about a Hungarian doctor named Semmelweis. He was an obstetrician. He was in charge of a hospital during this time period, and he oversaw the hospitals and what they did. So I'm going to flip back to my whiteboard. And this is our hospital, and it was a very large hospital in a city, and women would come there to give birth to be, safer. Now at this time period, giving birth was risky. A lot of women died in childbirth. A lot of children, infants died in childbirth. So doctors were monitoring that and trying to reduce that, trying to do the best they could for their patients. So people would come sometimes from a long way away to this hospital to give birth under the care of a doctor. So Semmelweis was in charge of the hospital. He actually had two wings. I'm going to call them A and B. So he had two wings, and they were staffed a little differently. Wing B was staffed by midwives, which again, historically, that's how women gave birth, women helping other women. So this was staffed by some knowledgeable midwives in the community. This side of the hospital was actually staffed by medical students. And again, everybody's under, a doctor, Semmelweis's observation, but they were the ones that did the work of giving birth. Again, giving birth was common, lots of people did it. Some medical students were in charge of that. Semmelweis would keep numbers and records, and again, childbirth being very dangerous, the mortality rate of people dying in childbirth in this part of the hospital was 20%. And that's pretty tough, but people did die. Problem was, Semmelweis noticed the mortality rate of women giving birth that were monitored by midwives was 2%. So you had a much better chance of survival when you were monitored by midwives. Well, again, he's a good doctor. He wants to do what's right for his patients. He wanted to know what's the difference? What is making this different? And again, the community noted. They took note. They would come in, and if you were headed into this wing, they would refuse. They kind of worked it on a rotating schedule. If you showed up on Monday, you went to this wing. If you showed up on Tuesday, you went to this wing. Women would travel in labor to the hospital, and if they were going to go into this wing, they would actually refuse to go and try to delay childbirth. And if anybody has ever had a child, delaying childbirth, not an easy feat, that actually would not enter the hospital. It became so bad that women were actually giving birth on the street outside the hospital because they were too scared to go into here and never come out. Interesting fact, people that gave birth outside of the hospital, their mortality rate was about 10%. You actually had a better chance of survival on the street than you did here in the hospital on this side staffed by medical students. So what's going on? What can we do different? Time period, medical students. Medical students were in lab. They were studying cadavers, gross anatomy. That's what was going on. The lab portion was separate from the hospital. It was over here. That's where they kept the dead bodies. Again, the smell was a problem. So they kept the dead bodies here. And basically it went to a medical student in lab working on a dead body. And somebody says, hey, Joe, it's your turn. Go over there and give them, and it's your turn to deliver the baby. And Joe stands up, shakes off his hands, wipes it on his apron, and goes over to the hospital and catches the baby. What these women were dying from was something called puerperal fever. What we now know is that is caused by a bacterial infection. The medical students were involved with the cadavers where there was a high amount of this bacteria and then transferring it to their patients. This was a problem. Now, Semmelweis, he was before, if you look at the dates, he was before Pasteur, he was before Robert Koch, he was before the germ theory. He did not know what was causing puerperal fever, but he was still trying to prevent this. So he had an idea. In the lab portion where they were working with the cadavers, they were already using chlorinated lime water, so it had chlorine in there, and they would use it to wipe things down and spray things down, not to get rid of bacteria, but it kept down the smell from the dead bodies. So they were already using this, and he decided to put a bucket of this chlorinated lime water out and tell the medical students before they go from the lab to the hospital to dip their hands in the chlorinated lime water. This was the first instance where we talked about washing hands to protect our patients. So he took some good records, instituted this procedure. In April, the fatality rate with the medical student side was 18.3%. He instituted this procedure of hand washing, and in June, the fatality rate from the medical student side was 2.2%, which, if you remember, was very close to where the midwives were. July was even better, 1.2%. August, 1.9%. So this made a huge difference. He followed it, he looked at it, and they were doing better. So, like any good doctor, he told his colleagues. He said, "Hey, we're doing this thing. It's great. You should try it." Problem was, Semmelweis was not a very good politician, and he was not telling his colleagues in a the news he was telling his colleagues was not well received. Basically, he came in and says, "We're dirty, we're killing our patients, you need to change what you're doing, you're a bad doctor." And his colleagues didn't receive this news very well. Again, this is a new idea. He didn't know why. They didn't know about bacteria, microorganisms at the time. He didn't know why. And he just wasn't very political in this. So his colleagues didn't agree with him. Despite the numbers, they didn't agree with him, and Semmelweis kind of championed this as his cause. He started spreading this far and wide. He started writing to politicians and trying to get this instituted because he was saving lives, and he felt very strongly in what he was doing. Problem was, the other medical professionals didn't want to hear it. And so eventually Semmelweis lost his position at the hospital. He was fired. He actually got so bad that they declared him insane, sent him to an insane asylum to live because he just would not give up this idea. And he was right, but he wouldn't give it up. So they sent him to an insane asylum. He actually died 2 weeks after being in the insane asylum, and he died from streptococcal septicemia, which is what they originally called puerperal fever. It is an infection caused by a streptococcal bacteria, and so the very infection he was preventing in his patients is what he died from. So poor Semmelweis and his tragic story, but we remember him because history proved him to be correct. Hand washing is still the number one thing we can do to prevent spread of infection and protect our patients. All right, so that was Semmelweis and his contributions. We're going to talk about two more. We have a doctor, Lister, and a nurse, Florence Nightingale. And you've probably heard of both of these. Lister was an English physician. Nightingale was a nurse, and they're both known for their contributions towards aseptic techniques. Lister, first thing you're thinking of is probably Listerine. Listerine has nothing to do with the doctor Lister, but he became so known for his cleanliness and his practices that prevented infection that the makers of Listerine used his name in the product so that their patients or their clients would associate that with cleanliness. So Lister, what was he doing? He was a surgeon, and the big thing with surgery back then is they could do a lot of surgical techniques, but then patients would die after surgery from infection. So this was a huge problem at the time period. And again, Lister's trying to do the best he can for patients. So he had the idea of using carbolic acid. And again, this is something that they knew would cut down the smell. Lister's living in a little later period of time. He now knows of the germ theory and that microorganisms can cause some of these diseases. And so he was using carbolic acid to wipe things down. He was the first person to have the idea to wipe down the surgical instruments, soak them in carbolic acid, to wipe down the tables and the instruments and everything that was used during the operation. You remember that other picture? They didn't seem very concerned about it. So he wiped things down with carbolic acid. Carbolic acid is a phenol. Another phenol you may be familiar with is Lysol. And we now know that these are getting rid of microorganisms. He has a famous story where a little boy was run over by a cart right outside the hospital and severely broken leg. It would have been a life-ending injury. You know, people thought he was a goner and he'd never recover. Lister brought him in, performed surgery, fixed the leg, but then he ended up soaking the dressings in carbolic acid and wrapping that around the wound. And nurses came back looking for signs of infection, gangrene setting in, the things that would kill patients after surgery. And they came back and checked it, and it was fine. So they soaked the dressings again, fresh dressings, put that on there, and the little boy recovered. So he was the first person that used that, made big improvements in how we're handling that. Florence Nightingale was a nurse at the time period, and she was English. She was actually kind of came from a wealthy family, and nursing was not a noble profession back then. It was done, it was hardly thought of. Women would kind of show up to help, and doctors would give them work to do that they didn't think was important, cleaning, taking care of patients, women's work, maybe, if you will. Florence Nightingale insisted that she wanted to be a nurse, went against her family to do this, and work there. There was no schooling back then. You just showed up and doctors told you what to do. But she was very good at her job. She kind of made a name for herself. Meanwhile, at this time period, England was involved in the Crimean War. Don't know much about the Crimean War, but their soldiers were dying. They were being injured in the battlefield, dying in hospitals, and when soldiers die, you can't fight. So this was a big problem, and women weren't allowed in these field hospitals. It wasn't a place for women, but Nightingale got permission to go into this field hospital. She brought some other nurses with her. When they got there, they found horrible conditions, sewage running through the camps, dirty clothing, poor food, just horrendous conditions. Again, doctors were doing what they could. They just didn't think this stuff was important. So first thing she did was order a whole bunch of scrub brushes. Anybody who was mobile, she put a scrub brush in their hand. She cleaned things from top to bottom. She instituted procedures where patients were given fresh clothes. Their dirty clothes were taken away from where the patients were and washed extremely hot water with lye soap. She started using better bandages and cleaning bandages, changing bandages. She improved food conditions, and patients started surviving. So she did a lot of work towards keeping the importance of keeping an area free of microbial contamination, towards aseptic techniques. The fact that we remember her is because she set up the nursing school, the first school for nurses, and the reason she was allowed to do that was because of her work from there. So we are going to stop this video here, and we'll pick up with the last chapter in the last video in this chapter.